Well, some of the most innocent victims of the healthcare crisis are the youngest. Children and families who can't afford to pay the doctor when they get sick. But here in Palm Beach County, there is a place to turn to find out how to get coverage and, even more importantly, medical care. Here's more.
Want your door blanket? Yes.
Gail Stern Walker and Donna Kirby have had to make the kind of sacrifices only desperate mothers make. When faced with life obstacles that could potentially prevent their daughters from living quality lives, both packed their bags and made Florida their permanent home. That's where a program called Children Medical Services offered the answers they were looking for.
When we came here, I initially went to a Medicaid office and Social Security. They directed me to all these places, and once I got with those people, they forwarded me to CMS.
Gail is a native of the Virgin Islands. She left her country when Abigail was 5 years old. In the Virgin Islands, she had to travel every month to Puerto Rico so that her young daughter could receive care for a then unknown illness.
They couldn't diagnose cerebral palsy. It was a gynecologist sitting in for the pediatrician when she was a year old and said, "Have you ever heard of cerebral palsy?"
Once diagnosed with cerebral palsy, the doctors informed her that there was nothing they could do.
It's so nice seeing you.
Yes, likewise.
Waving.
Donna's daughter Kaylee was born 13 years ago with a chromosome disorder. She's a test case that's been published, so her condition has never been seen before. When Kaylee was born, Mom was a working nurse at St. Mary's Hospital. But when the insurance failed to cover all of Kaylee's medical bills, Donna had to quit her job and look after her daughter.
As we know, insurance companies insure healthy people. They don't insure sick people. There isn't anything else.
The entire family lives in the Northeast, and even though she's very close to them, moving is not an option. Not without a program like CMS.
For the wheelchair modifications,
When she was born, of course, she was she was on machines and tubes and all that. So she was hospitalized for about 3 months. And at that time, I was introduced to CMS and their program. And I guess what drew me to it, I don't know if I really picked it. It kind of picked us because it works with kids like Kaylee with all her needs because they house all the facilities under one umbrella. And so that all of her care and everything that I can get is centralized in one place. And for people with handicapped children, in and out of the car, all the equipment, the lifting, the hauling, the beauty of that, And I'm a single parent, and I would have gone home a million times. And honestly, I stay here because of this program.
Housed in the Palm Beach Healthcare Pavilion in a brand new building located in West Palm Beach, Children's Medical Services provides medical attention to kids with special healthcare needs from the time they are born until the age of 21.
We have children who have Medicaid coverage, we have children who have Florida Kid Care coverage, and we have children who we call our safety net children who come in without any insurance at all initially, or they might be underinsured in terms of private insurance packages that do not cover all of their health care needs.
Any child that comes to this clinic, regardless how difficult their medical condition is, we provide all services that are needed for this child under one roof. This gives local practicing physicians an opportunity to give back to the community. They provide the services, and the children receive all of the special needs that they require.
We use them for a wheelchair clinic. I use them for ortho clinic. She has a pediatrician through Medicaid, so she don't do pediatrician services here. But with the wheelchair, it has been very helpful, and they coincide with her support coordinator through MedWaver, and they coordinate with them to get me the services I need. So it works out perfectly.
But services aren't limited to medical attention. A lot of emphasis is also placed on making sure the kids are comfortable. Through the wheelchair clinic at CMS, Gail was recently given a $7,000 lift for her home. And on this day, Abigail's chair is being looked at.
Now we'll put in a quote. We'll get the prescription, and I'll get a quote for the parts, and we'll submit for approval to Medicaid. And then once we get approval, we can go ahead and order the parts, and then set up an appointment to install the parts.
We always look at what's medically necessary and medically the critical needs of the child, so those services are very much covered. We have nurses and social workers that work with the families. They'll do home visits. We have found many foundations. We use different pharmaceutical programs that are free if a family has no pharmacy coverage for drugs. We would work with them. We might cover it until they're approved through that program.
Okay. When we get a chair, we can still make all the adaptations for the shorter leg and all that kind of stuff. Okay.
We're working together. Barriers are down. There are no boundaries, and everybody's working together with the child and the family foremost in the center to provide the best care.
Such a comfort for me that I can actually walk away, like if Kaylee has an emergency ER visit and they come in, all the doctors work as a team. They'll know Kaylee. She has a very individual special needs. She has allergies to an anesthesia. So Kaylee can't be put under, but those doctors know it.
CMS is largely possible thanks to the Palm Healthcare Foundation. Currently, Children's Medical Services serves over 3,500 children and families in the Palm Beach County area alone. Before now, many of these kids have had to attend different providers in different settings. But now, because of the foundation, providers are brought together as a team to serve the children with the ultimate care. And for that, these two mothers are forever grateful.
I really don't think my daughter would have had that much success as she's had without CMS. Good example, they paid for a 7-hour surgery in Miami, a selective dorsoirotomy on her spine. She was supposed to come out walking, but you know what? She came out talking. She started talking when she was 8 years old. She hasn't stopped talking since. But it's a good thing.
If I summed it up in one word, I would say that CMS gave us a life. It gave me the ability to have a life, rather than be a shut-in in a house with all her stuff.
It's very challenging to have a child with special health care needs. We all dream about our child, and we dream of a healthy child. And it just takes one incident, whether it be a premature baby, an accident, for our lives to change and have a child with a special health care need. And it impacts the entire family. And I think this program wraps around our families to provide them with the support that they need during those challenging times.
You did that for water, that's for sure.
Now, a side note, one of those involved in CMS and the pavilion is spokesperson Dr. Mehmet Oz. He believes that this kind of facility will go a long way in making things better.